Hi everyone, my name is Nabella and today I will be presenting my disease project on acute glomerulonephritis, also known as AGN. Throughout this presentation, I'll explain what the disease is, the cause, how it's treated, and how it affects patients and their family. Acute glomerulonephritis is an inflammation of the glomeruli, which are the tiny filtering units inside the kidney, and their job is to remove waste and extra fluid from the blood while keeping important substances like blood cells and protein in the bloodstream. And when these filters become inflamed, they can't be able to do their normal job, which is to remove waste and extra fluid from the blood. The most common cause of acute glomerulonephritis is an untreated streptococcal infection. One thing I found interesting when I was doing this project is that the bacteria themselves don't actually damage the kidney. So instead, the immune system creates an antibodies to fight that infection. So when there is the bacteria and then the immune system creates an antibodies to fight the infection, and these antibodies created by the immune system combine with the bacterial antigens to form immune complex. So some of those immune complexes, they become trapped inside the glomeruli. Now this is what causes the inflammation. It triggers the inflammation, and this leads to reduced kidney function. Biological mechanism, this was probably one of the most interesting part of my research. The glomeruli acts as like a tiny filter. Normally they remove waste while keeping blood and cells and protein inside the bloodstream. When the immune complex become trapped in the glomeruli, they trigger an inflammation. White blood cells move into the kidney and damage the filtering membrane. Because of this damage, blood and protein leak into the urine, while waste products like salt and fluid stays inside the body. Now this causes swelling, high blood pressure, and decreased kidney function. Common symptoms include swelling around the eyes, the face, ankles, and feet, the presence of blood in urine, protein in urine, decreased urine output, flank pain, fever, loss of appetite, fatigue. These symptoms happen because the kidney are no longer filtering blood effectively. Treatment is mainly supportive because the inflammation often improves over time, and the doctor usually just focuses on controlling symptoms by reducing the swelling, lowering blood pressure if their blood pressure is really high, and managing fever. Patient may also be placed on a lower sodium diet and fluid restriction to reduce the stress on this kidney. So if the bacterial infection is still present, antibiotics are also prescribed. The treatment table summarizes on the treatment. For example, diuretic helps remove excessive fluid. Antipyretics help reduce fever, as well as just consuming a low sodium diet and being on a fluid restriction, which helps prevent the fluid buildup, and the antibiotics to help eliminate any of the remaining bacterial infection. Acute glomerulonephritis affects both children and adults, but usually under children that are under 14 years and adults that are over 85 years are affected most usually more often. And according to a recent research, there were more than 500 to 2,800 new cases worldwide in 2021. Although the number of the cases has decreased over the past few decades, researchers they predict that it may increase because of the population is growing, and also because the complication that comes with aging. Fortunately, early diagnosis and treatment continues to improve patient outcomes. So there is, if it's caught on early and if it's an early diagnosis, then this can improve the patient's outcome. And new advances and new researches. So one of the biggest advance in research involves the complement system. So the complement system, which is part of the immune system, scientists have discovered that it plays a major role in causing kidney inflammation. Although the complement system normally helps fight infection and acute glomerulonephritis, it becomes very overreactive and damages the kidney. Because researchers now understand how the complement system contributes to the kidney damage, they are developing new medication called the complement inhibitors. These drugs target specific immune proteins instead of suppressing the entire immune system, which may reduce the side effect while still protecting the kidney. Researchers are also studying new blood and urine biomarkers that may help diagnose the disease earlier. Another exciting area is the precision medicine, which aims to provide more personalized treatment based on each patient disease process instead of just, prescribing medication. Social impact. Although many patients recover completely, the disease can still have a significant impact, especially medical visits, medication, hospitalization can create a financial burden. And then also, children that are dealing with this disease may miss school because of the fatigue or the back and forth hospital appointments, and also parents are, or the caregivers are affected because they might have to miss work to provide care or even take their children to the hospital. Social impact. Families can also experience emotional stress while managing medication, especially diet. It's very important that someone who's dealing with this disease is on a low sodium diet. So that is another emotional stress, and then as well as the follow-up care. In addition, patients who live in a rural or low-income communities, they may experience limited access to a kidney specialist, making the treatment more difficult. And so I wanted to include a patient and a caregiver perspective because the disease affects more than just the kidneys. It affects the child or the patient, the person who's dealing with this, as well as the caregiver. So a child with acute glomerulonephritis, as mentioned earlier, they may miss school, sports, even a time with friends because of the appointments or the fatigue, which are the symptoms. At the same time, parents often need to take time off of work to manage medication and manage special diets and attend follow-up appointment, which can create an emotional and financial stress. So these are the references I used to prepare my presentation, and this is the end of my presentation. Thank you for listening, and I hope that you learned something new about the acute glomerulonephritis.